If everyone loves their head, then why don't we do more to protect it?
Head injuries can lead to death, long hospital trips, or starting physical abilities like walking, grabbing, and hygiene abilities all over.
If we are able to see atoms, put men and women in space, make a bomb that can destroy a whole country, and create a flying vehicle, why can't we make helmets that are safe enough for our own heads and brains?
Both Charlie and I are students and play physical sports. Concussions are a huge risk for both of us. We both have helmets, mouthguards, and the correct padding for each sport, but are they enough?
Getting hit in the body can end a season or a few games for a kid, but getting hit in the head can shatter your whole life.
You might think differently, talk and look weirder, and that can ruin your chance to live normally.
More severely, you could lose all body function or some sensation in your limbs and toes, or even die.
Around 445,000 sports-related injuries happen every year, varying from many activities including cycling, football, and soccer.
My dad took me out of football after my 4th grade season because in 5th grade it became travel ball, and he did not want to take the risk of a severe injury.
Some of the most severe head injuries are CTE, major concussions, skull fractures, or hemorrhages.
CTE is a progressive degenerative disease of the brain found in athletes and others with a history of repetitive brain trauma, including symptomatic concussions as well as hits to the head.
A concussion is a temporary unconsciousness caused by a blow to the head. The term is also used loosely for the after effects such as confusion or temporary incapacity.
Skull fractures can lead to unconsciousness, or arteries and veins can bleed into spaces around the brain tissue.
A hemorrhage is an escape of blood from a ruptured blood vessel, especially when profuse.
Sports are not the only way that you can get a head injury. 40.5% come from just falling, 14.3% come from vehicle-related collisions, 15.5% come from getting struck straight in the head, and 10.7% come from assaults.
Some of the most common symptoms of a major head injuries are loss of consciousness or a concussion, seizures, vomiting, balance or coordination problems, serious disorientation, inability to focus the eyes, abnormal eye movements, a loss of muscle control, a persistent or worsening headache, memory loss, and changes in mood.
Some of the most common symptoms of a minor head injury are a headache, lightheadedness, spinning sensation, mild confusion, nausea, and temporary ringing in the ears.
I know we are only 14 years old and only have 9 years of education, but if these symptoms are repeatedly occurring in your life, you should probably see a doctor.
There has been many deaths due to severe head injuries. When you think of a head injury, you usually think of hurting yourself from your forehead up, like getting a concussion or being knocked out.
It's the little things like mouth guards and face masks that can make a difference.
But protecting your face is also important. Studies found that high school football players wearing store-bought mouth guards were more than twice as likely to suffer mild traumatic brain injuries than those who wear properly fitted custom mouth guards.
All contact sports have special pads, helmets, and requirements for legal play.
Helmets are hard or padded protective hats often worn in contact sports. Helmet technology has skyrocketed in the last few years, creating new types of pads to cushion and support our skulls and necks on impact. Sports-related dental injuries account for more than 600,000 emergency room visits each year. Mouthguards are recommended practically for contact sports such as boxing, football, hockey, and lacrosse. An athlete is 60 times more likely to suffer harm to the teeth when not wearing a mouthguard, which can lead to a severe head injury. But the most important thing to remember is to always stay safe and have fun.